Mercedes was born. Today, I'm only discussing some of the avenues you may want to explore when thinking about easing the financial burden of your fertility journey. Please remember to consult your financial advisors and accountants before you really think about which of these strategies might work for you. Everybody's situation is unique, everybody's journey is unique. And so although these are great pointers, they may not be 100% applicable for you. And I just wanted to add, and I've told Carolyn this, I'm happy to share my contact information for later. If you want to kind of have an ad hoc conversation after, I can give you some tidbits. As Carolyn mentioned, this is something that I am very passionate about and do hope that we can kind of end a little bit of the stigma around how can we finance this.
Great. Thanks, Meredith, for sharing part of your story. It's really helpful. So I think when we're looking at financing a fertility journey, I mean, lots of times, on average in this country, one cycle of IVF, including medications, is, can run up to or more than $15,000. And, there's no guarantee of a baby at the end. It's not like buying a car or buying a home. So for lots of, whether you're an individual or a couple, lots of people don't have that type of money sitting around in a bank account. Typically, you're a younger couple starting your life out together. How does that, talk about maybe when you're just starting out on this journey, what are the things you need to consider to kind of make this work?
Yeah, that's a great question. Most of us don't have that kind of money sitting around. So first of all, some of my comments are COVID-19 and today's time related, and other ones are more broad and they apply no matter what. Okay. So I would say, no matter where you are on the journey or anything like that, it's really time to create a realistic budget for the next couple of years. I think the best place to start when you're looking at your budget is look at your current expenditures. Don't go all in and say, okay, today I'm going to save this by not doing this. I think it's really important that you understand what your current habits are. So a couple ways you can do that. You can track your expenses through some apps that will actually pull in all the data from your credit cards and debit cards. And so you can kind of analyze that information for a couple months. Or you can even just track all your spending manually for a month or two and then annualize that over a year and make sure that you add in the things that you wouldn't have incurred during that month. Maybe it wasn't a month where you were going on vacation. Maybe it wasn't a month where you had a lot of holidays, those kind of things. So start with, where's your current point? And then think about what are some of the things in your budget that you can go without. So if you have a partner, so you and your partner, just for example, if you cut back on those $5 coffees every day, if both of you cut back on that, you'd save $3,600 a year. So that's not, yeah. So that's not,
a lot. That's a lot of money.
It is a lot of money that you are literally drinking. I make coffee at home. Sure, it's not Starbucks, but it's actually I buy the Starbucks coffee and I make
the Starbucks brand.
And it's great. So $3,600 might not be enough to save for your entire treatment, but it is something. What else can you save? What else don't you need? Do you need all the cable? Are you actually watching it all the time? Those kind of things, they really do add up. It's not necessarily having to eliminate the large things, but it's the little things. Can you not go out for lunch one other time per week? Just the very little things.
And do you suggest redirecting that money? How do you suggest, so if I went out for lunch with my girlfriends once a week, and then I went out with my work buddies another day a week, and I cut one of those lunches out, would you suggest like redirecting that money into a different bank account? How should people do that?
Yeah, so there's a lot of different ways you can do it. You can absolutely just put it into a different bank account, or you just don't spend that pot. So you don't see it, you don't notice it. You can automatically every month, if you know that you are going to save approximately $150, let's say, something like that every month, put that directly into another account. So set up an automatic transfer to another account that you don't touch.
That's a great idea.
And then, when you have enough, like I wouldn't necessarily put you can, I mean, you can put it right into your TFSA every month, whatever it is, and then have that managed so that it is investing. I would recommend utilizing something like a tax-free savings account or just a regular savings account, as opposed to directing the funds that you are saving specifically for fertility to an RRSP. The difference is really just the tax consequences when you take it out. A tax-free savings account is really meant for those saving items and the short-term / long-term things, whereas an RRSP is really meant for your retirement. And so the tax treatments on those are very different. So if you can avoid it, don't take money out of your RRSP to fund your fertility journey. That was a great question. So I'm just going to talk about a couple other ways you can, while you're going through treatment or before you've started treatment. It's really important when you're looking at that budget and when you're thinking about what you have, think about how much you can realistically afford for treatments. What is your point where you might need to stop or you might need to pause and reevaluate your situation? Unfortunately, fertility treatments are quite expensive. And as Carolyn mentioned, there's no promise. And so you just really have to be very mindful of how much you're spending and where is that going to put you into a financial situation. If you've already met with your fertility clinic, get a budget from them, get an understanding of what the costs are and what are the various costs for different options down the road. If you start with IUI, they can give you a price for IUI. And then if you have to go to IVF, what is that going to cost you? You just really have to be very mindful of what you're getting into and setting yourself up from there. And the other thing is, if the clinic that you're going to is not local, make sure that you're budgeting for those kind of things too. Your hotel stays, your gas,
time off work,
anything like that. Which also goes into the point I was going to mention about work is if you're in a situation where you feel that you need to, you have somebody who you report to, it's probably important to speak with your boss ahead of time if you're going to be late for work or anything like that, because the last thing you want to do is risk your employment because you're doing fertility treatments. I believe that most workplaces will be accommodating for this. However, if you don't tell them what you're going through, they don't know. It is difficult to talk about, but they also cannot discriminate you because you have these medical things that you need to go for. But if they don't know, they can't help you. Another really important thing to talk about and to think about is your workplace plans, your workplace insurance plans, if you're fortunate enough to have one. Most couples typically only will take advantage of one plan because they don't really need both of them. If you're thinking that you're going to need fertility treatments, it's a great idea to investigate both plans, look at whose plan might be the better option, or even double up on the plans for the time that you're going to have the fertility treatments to take advantage of substituting one for the other or the top-ups or anything like that.
That's a great idea.
And then you can, once you have your child, hopefully, you can then revert back and then reevaluate at that point what's the best plan for you. But it might be a good idea, and the premium on the plan is probably less expensive than the money that you're going to have to pay in medication. In a same-sex female couple, I would very much really think about this, because if both partners are going to be having a baby at some point and the plans max out at $6,000 of fertility expenditure per person, you may be able to really double up on that kind of reimbursement. So I would just really look at what is the workplace plans that you have to offer, and can you take advantage of those? These are things that we wouldn't really.
Sorry, I was just going to say, for those of you who don't know, you can actually access the fertility clinics will send you the list, typically a list of the medications. And so you can actually take the DIN number from the medications, enter it in, or call your insurance provider and ask them if those specific medications, some medications may be covered, so others may not. All of them may be covered. And then they can tell you the percentage of that as well.
Absolutely. I remember writing a lot of DIN information in to see if it was covered. Another thing that a lot of times we don't think about, and this will not apply for everybody, but if you are in a situation where you feel that you may get an inheritance down the road, speak with the person who you might be getting the inheritance from. Is there some funds that they can give you ahead of time to maybe help you within your fertility journey, so that the people who are giving you these funds will be able to also hopefully take advantage of having another child in the family and see that child. Typically when you're getting an inheritance, it's for your happiness, it's for you. This is something that somebody wanted to do for you. If they don't know that you're thinking about a family journey plan, then they can't help you, but maybe they want to give it to you ahead of time. So these are just things that you need to be open and honest about. And then there's also traditional financing. So go to the bank, apply for a loan, see if you can get a line of credit. The good advantage of COVID-19 is it has really reduced interest rates to a point where they're probably as low as they're going to be for a very long time. And so, if you live in a house, you can think about, can you get a home equity line of credit, something like that. This will not apply for everybody. It's not a blanket solution, but this may be something that you want to think about. So
that means it's good to have a sort of an open, if you don't have a financial plan, or if you're not working with a bank, it's probably a good opportunity or a good suggestion to start those conversations, at least to see where, because there's lots of things that you can work out. And, if it's because of a credit score that might be lower, well, maybe there's some time for you to build up the credit score and then be able to finance a little easier in a couple of months when the clinics reopen, or when you're actually ready to start the process.
Yeah. So those were kind of my tips about how you can start planning for your journey.
That's great. So you mentioned COVID, so I want to go there. I know this is not going to be a COVID talk, but I'm curious, there are patients right now who have paused treatment or started treatment. There's probably some loss of jobs, so potentially a decreased income right now. Do you have any suggestions or ideas for individuals or couples there?
Yeah, so it's a great question. First of all, if your cycle was paused due to COVID, I empathize with you. I know how frustrating that can be, and it is something that is entirely out of your control. Hang in there. Hopefully, we are flattening this curve, and we will be able to get back to our medically necessary appointments as soon as possible. It is a great opportunity, again, to re-look at your budget. What have you not been spending on now that you feel that you could go without? Most of us aren't going out that much. Is it really harming you to, save a little bit of money if you can? When you are able to return to the clinic, talk to them. Ask them if there's a way that they can refund part of the cycle. Can they put those fees towards your next cycle if you've already paid for them? Can they help you? Can they work with you? If you don't ask them these questions, they're probably not going to just give it to you right away. They are, after all, they do have to pay themselves. They have to pay their staff. But if you ask them, then you just never know. I think it's also an opportunity to review the financing options that your clinic may have. Do they have an affiliation with a company that can help you? Do they have a financing option? Can they put you on a payment plan? Something like that. Most clinics, yes, they are businesses, but they also do want to get people pregnant, and they will work with you. You just have to be upfront and ask them for this.
Right.
If you have a credit card that earns points, I would probably try to use that card to pay for some of your treatments once you go back, assuming that you can afford it and that you're not going to be carrying the balance on your card. I do think that it is these are expensive costs, so you might as well take advantage of some of the cash back or travel options that you can have through a credit card. If you don't have one of those cards now, it's a great time to think about it. Right. Typically, the annual fee is waived for the first year, and then any benefit that you might get from spending so much money on that card is definitely covering that annual fee.
And then you put so for example, you could put the fee on the credit card and transfer the money right away from a line of credit or something right onto the card. So you're not carrying that balance. Yeah,
whatever you need to do, but I wouldn't get a credit card just for the sake of getting a credit card. But if you can have one, do it. I think if you are going to be repeating the same cycle again during COVID or non-COVID times, talk to the clinic about, maybe you need to ask them, can they think about some other options in this treatment cycle? advise them that you're not necessarily comfortable going through the same cycle again if you didn't have results the first time. Maybe there are ways that they can tweak the cycle to increase your results and therefore reduce the financial burden on you, because you're not going to repeat a cycle potentially unnecessarily. Can you get on a waiting list if you are in a province that has funding? Can you put your name on that list now? Can you just get there? It's not an option for everybody, but it will work for some. This might also be the right time to take that break. Maybe you've been going through treatments for a couple months, couple years, and you need a break from this. And you need to regroup, you need to reevaluate, you need to really look at your finances, see where you are. What can you do to just push you through this little bit of time? It's not great, but there are ways that you can kind of use this to your little bit of advantage. Something to be very mindful of is when you are submitting your insurance claims for your medication, make sure that the insurance company is reimbursing you for what they're supposed to be reimbursing you for. When I was going through fertility treatments, every time I submitted my S-Trace receipt, I would get a different amount back. I never understood it. I never understood why the insurance company was giving me, some money this time, some money that time, nothing this time. And it turns out they weren't looking at it correctly. They weren't realizing how many doses I had. And so just being very mindful and review all of your claims to make sure that they're actually reimbursing you the way that they should.
Well, that's great advice. Something lots of people, you would just assume, I would, just assume that they know what they're doing and that's what I got back. So that's a great tip.
And just keep doing that. Sometimes they won't cover one of the expenses, but they should be covering it. So you just have to inquire as to why they're not doing this. Sometimes the apps and submitting it online is not the same as actually submitting the full receipt. So just question them as you're submitting those. And the other thing is just, as COVID-19 has told us, and quite a little bit of other things have taught us, is plan for the unexpected. It's really important to have a buffer, because you don't know what's going to happen down the road. Personally, we needed PGD and PGS. PGD at the time was not offered in Canada. And so that was an extraordinary US expense that nobody would have told us we needed until we got down that road of figuring out what's actually wrong. So just make sure that you have that buffer and plan for the unexpected.
That's a great question. I've got 2 questions that come in. Do we have time for 2 questions while we're in the middle, or am I cutting off your thought?
No, we can do that, or we can just talk about what happens after. It's totally up to.
So let's talk about this. I'll ask one question here through Zoom. How much before treatments would you suggest setting up a line of credit? Is this even possible with the banks closed? I don't know. Are banks closed? I don't know.
If I can tell you, banks are not actually closed. I wouldn't necessarily venture into a bank right now if you don't need to, just because there's, quite a little bit of, it's risky. You just don't know who else is there, but they are still open. They're also open on the phone. So you can still get your banking done. If you have a home and you wanted to think about getting a line of credit against your home, that's very possible to do right now. And it's also possible to apply for a loan online. A lot of banks are also shifting their teams to be able to work from home. So the advisors, instead of sitting down one-on-one, are having interactive chat sessions with somebody. So it is absolutely possible to speak with your bank. You just won't be there face-to-face.
Awesome. That's good to know. One other question, and I can speak to this. It's coming in. They're just wondering if we're going to review what's covered for IVF in Ontario under the public funding. So for those of you who don't know, the province of Ontario does cover publicly funds the cycle of IVF. We probably aren't going to touch on it too much today, but we do have a session at 1 p.m. Eastern today, specifically with a board of director from Conceivable Dreams, which is the patient advocacy group in Ontario, and they will be talking about all of the information on the IVF program that you need to know for Ontario specifically. Sorry, Meredith, let's go on to what to do after you finish your treatments. Or
one more thing I wanted to add actually about just while you're going through the process, or even once you've been successfully pregnant, but it's typically something you should do while you're going through the process or before you even start the process. Research any grants or subsidies that may be available to you through a religious or a non-religious organization. There are several out there that will offer some funding to people of specific denominations. Once again, this won't apply to everybody, but there is a lot of interesting options out there if you are looking and if you can research them. Wow. So I just wanted to briefly touch on what to do once you're successfully pregnant. So, congratulations, you've made it this far. Now, the fun part is thinking about how expensive it is once the baby arrives. Mm-hmm. Definitely not as inexpensive as I thought it was, but also you've now spent all this time and all this money and you've been poked and prodded and everything. And so it's time to, really love that child and do whatever that child needs. So if you, another time, look at your insurance plans. Do you have coverage for a private room? If you want this kind of coverage, maybe you should switch your plan now. If you're comfortable in a semi-private or ward room, that's great too. Just look at your plan. What does it offer? Another thing is putting your child on your health plan if you can. Personally, I live in Ontario, and this was when they had started funding and started prescription drugs for children under 25. I thought at the time I didn't need to put my child on my workplace plan. I was penny wise and dollar foolish. I quickly learned that the medication that she needed was not covered by OHIP Plus, which was our provincial funding. I could have paid $100 to put her on my workplace plan, and that would have covered the first round of her medication. So just think about should you put your child on your plan right away? Can you wait? I'm an advocate for just getting them on a workplace plan if you have that option. You don't need dental right away, so you can save on that one, but health benefits I really think are really important. Think about putting in money for that registered education savings plan. The government matches 20% on the first $2,500 contributed annually, up to a maximum of $500 per beneficiary per year. So that's basically $500 of free money from the government. It is a great program. It is something that you can qualify for, most will qualify for. So I would definitely recommend looking into that. And then the other thing is, this is just a personal thought. I would avoid a baby moon. Baby moons are really popular or whatnot, but if there is any complication while you are away, the cost to get you home, get your baby home, any sort of treatment that you may need is most likely not covered by your plan or by your provincial plan. So while I know everybody wants to celebrate, I would just be very mindful of the costs that you could incur if you have a baby moon and something goes wrong. Hopefully it doesn't, but something could. So just food for thought. That's my little caveat to you. I really just, these are just little tips and tricks. Don't forget that fertility medications and treatments and tests are tax deduct their medical expenses on your tax return, very timely considering it's April. So you can claim those, and you can also go back and adjust your previous year's tax returns if you haven't claimed them from previous years. Though those are really,
yeah. And sometimes, you can even claim, correct me, Meredith, if I'm wrong. So not only the medical expenses and the medication expenses, but also travel. Is that that can be
yes.
part of your tax return for your treatment, which can add up, especially if you've there are patients in this country who have to fly from Newfoundland to Ottawa, from Newfoundland to Halifax, from Thunder Bay to Winnipeg. Where there are those costs, which can really help come tax time for sure.
Absolutely. Yeah. It's definitely important to speak with your tax practitioner as to which ones can qualify. If you're living in the same city, chances are the commute to and from the fertility clinic is not tax deductible. However, if you are having to travel X number of kilometers, then yes, the costs to do that are reimbursable. So awesome. I would definitely look at that.
That's great. We do have a question from Facebook. How do we know how much we will need to budget for?
That's a great question. And unfortunately, you won't. That's why I would recommend speaking with the fertility clinic and talk about what are the options that they think you're going to need, and what is the process that they're going to go down, to determine when to stop one thing and when to start another, and how many cycles, like let's say they think that you should start with IUI and then go to IVF. How many cycles of IUI do they think is reasonable to try before moving to IVF? And then from IVF, what are the next options? There is no answer. I mean, I would personally probably budget $20,000 for IVF. But there's and it depends on, different parts of the country have different, it's more different clinics. It's not the same across. So on average, a fertility treatment with medication, IVF cycle in Canada is between $10,000 and $15,000 on average. So that doesn't include PGS or PGT testing, or additional potential tests. Some clinics, so ask your clinic for that. They will have a financial sheet for you. Like I said, ask for the medication sheet, and you can check those DINs against your plan for work, and then you can kind of plot out a little bit an average cost for what it may cost you. The other thing that you can consider is, if you're not in one of our support groups, those questions are asked a lot. And so, of course, it's incredibly individualized, but it's conversations. If you've got patients at some clinics, you can connect with them to say, like, on average at this clinic, how much has a cycle, an IVF or an IUI, or those types of things. The other thing is to consider, make sure that the testing, some of the testing, the diagnostics, can be covered under provincial plans. So just making sure that you're actually accessing that you're not, if it's covered by provincial plans, then you won't be paying for those out of pocket necessarily. Yeah. And like Carolyn said, everyone's fertility journey is unique and everyone's finances are unique. So your personal financial situation is going to be very different from the person sitting next to you in the fertility clinic. And same thing, your fertility journey is going to be very different from them. So it's a very individualized thing. I think first and foremost, you have to do what feels right and what is right for you, your partner, your growing family, if you already have a family. It's really about just ensuring that you do what's right for you. You do you. I think that's the most important thing, is do what's comfortable for you.
Comfortable. I agree. You have to be comfortable with it. We do have another Facebook question. Any advice for how to pay off the debt after you've done your cycle?
That's a great question. I would go back, win the lottery.
Wouldn't that be lovely for all of us?
I would love to win the lottery right now. But really, if you haven't thought about some of the things that you can eliminate in your budget, think about that. So I realize it's very basic, but I would go back to, what are the things that you don't need that you're currently spending on that you can redeploy towards paying that debt? So let's say you didn't already eliminate that coffee habit every day. Can you eliminate that daily and put that money directly onto paying off your line of credit? So every month, $200 goes to the line of credit or to your bill, and you're done. If you did use a more expensive financing option, can you refinance that into a lower interest rate now? If you've suddenly been able to afford more than possibly what your monthly payments are currently? Can you increase your monthly payments? Can you talk to the financial provider about increasing those? It's really just about what's going to work for you and for your situation. If you got a raise at work, can you take the money that, the difference in between what you were previously making and what you're making now, and just put it automatically away into repaying that debt or into another account that you don't see? It's really just being mindful about your expenses and what can you cut back on and where can you redeploy your money.
That's a great question. We do have a question here on Zoom. Do you have a website or an email where we could look for further information about grants or subsidies? So Fertility Matters, on our website, we have a link to show there are 4 provinces in Canada who provide some sort of financial assistance or program, provincially based. New Brunswick, Manitoba, Ontario, and Quebec. So if you live in one of those provinces, please, I'm just going to get the link here for you. I'll let you know what it is. You can check out, it drives you directly to the link for your provincial fertility treatment fund cycle, what that looks like. Each province is different. For example, if you're in New Brunswick, you have a one-time $5,000 grant. So it's not payable upfront. You do all of your treatments, you pay for that, you submit a claim, and you get 50% back up to $5,000. In the province of Ontario, for example, they have a funded program where everybody is eligible for one treatment cycle. It's a tax credit in New Brunswick or in Manitoba, and there's potentially some changes. I've been hearing a little rumbling about what's going to go on in Quebec. So Quebec's always funded fertility treatments for quite some time. So the website that I was talking to you about, so if you're interested in one of those 4 provinces to look at the program, fertilitymatters.ca/funding-by-province. That's it. And we'll have the information there. Meredith, do you have
I was just going to pop in about the subsidies and grants and that kind of thing. I don't know if there is a database for, any of this, but I would really just do Google searches, to be truthful. That's how I found it. Or, if you're looking for a religious grant, speak to somebody within your community. I would caveat it by making sure that the website that you're looking at is A, legitimate, and B, from Canada. Yes. Unfortunately, there are more options and more, not unfortunately, but it's the reality. There's more options and more choices for the US, but sometimes you can look at a site and everything looks really hunky-dory and you get really excited and then you realize that, oh, I live in Canada, I don't qualify. Mm-hmm. So just make sure that before you get your hopes up, you are looking at a Canadian site. Mm-hmm.
There is funding options available for young cancer survivors. So if you have been recently diagnosed with cancer and need fertility preservation of eggs or sperm, or if you're on the other side of your journey, if you're a cancer survivor and are now moving forward and need to use ART or assisted reproductive technologies to build your family, we highly recommend you connect with our friends over at Fertile Future. There are programs there in place to help support fertility treatment and medications that way. Right. Does anybody else have any other questions? Stephanie on Zoom says, sadly, British Columbia does not cover. No. However, Stephanie, there is an organization in British Columbia called IVF for BC. They are your provincial patient advocacy group. I highly recommend you reach out to Nicole Noosh there. They're always looking for patients. They're highly active in engaging your provincial government for this type of funding. So please, I suggest that you reach out. And for anybody else that's on this call right now, reach out to your provincial groups, IVF for BC, Conceivable Dreams in Ontario, East Coast Miracles for the Atlantic provinces. We're always looking for patients to get involved, to advocate, and also Fertility Matters Canada. So we advocate for equal access to care in this country. That doesn't mean that it may be the same program for each province. It has to work for the provincial governments, but it also has to work for the patients and the clinics. And so please connect with us in the coming months. We'll be doing a lot of advocacy work, and we will be calling on patients to raise their voice and send letters and help us continue the advocacy work for patients across the country. It's really important. Meredith, in closing, do you have any other things you'd like to add?
Really just, like I said, you have to do what works for you first and foremost. I'd love to hear any takeaways or any tips and tricks that you got. You can follow me on Instagram at Mayor Mednick. I'm not giving it's no shameless plug. It's really so that you can just ask questions if you have any questions. Absolutely. There that you didn't get a chance to answer. On Facebook, I'm Meredith Mednick. I'd be happy to answer any questions that you may have. Just remember that it is a journey. It takes time. Don't put yourself in an uncomfortable situation. We all want a family, but just do what works best for you. And you have to put all, you have to ask the clinics for relief. And the other thing too, I don't think I mentioned this, is talk to the clinics about your budget. Some clinics may be able to reduce pricing to maybe get specific coverage for a certain drug. They may be able to work with you, come up with a plan that's going to work. It's just really about being open and honest with the clinics and the doctors and the finance directors. They're probably not going to provide you with the information if you don't ask for it.
Great. Thank you, Meredith, so much for that. So I don't think we've got any other questions that have come in, but if you do have questions, you're watching this after the live broadcast, please leave the comments or your questions in the comment section. We can check them and connect with Meredith if you need specific advice. Meredith, thank you for your time today. We really appreciate it. For everybody watching, thank you so much. And don't forget, it's Canadian Infertility Awareness Week. All week, we run the 19th to the 25th. We've got live broadcasting with fertility experts happening throughout all the day, every day this week. We've got one this afternoon, one this evening, 4 tomorrow, several on Friday, some on Saturday. So please connect with us. Check out our events page on Facebook and on our website to ensure that you're getting updates and notifications on all of the things we've got going on. And if you would like to share your story, please do. We will connect with you. Hashtag Fertility Matters, hashtag CIAW 2020, hashtag We See You 2020. Thanks, everybody. We'll see you soon.